Dr. Kelly Reynolds received her doctorate degree from the University of Arizona and a master's degree from the University of South Florida's Department of Environmental and Occupational Health. Currently, Dr. Reynolds is professor and chair of the University of Arizona's Department of Community, Environment, and Policy. She's program director of Environmental Health Sciences at the Zuckerman College of Public Health and director of the Environment, Exposure Science, and Risk Assessment Center at the University of Arizona. Between 1971 and 2000, waterborne pathogens resulted in nearly 600,000 cases of serious illness in the United States. And Dr. Reynolds suspects that millions of cases were undocumented. So she is working with the U of A engineers using lasers to detect human viruses in drinking water. This type of technology would not only expedite the process of discovering waterborne viruses, but it could also detect viruses that were previously undetectable. In another study, Dr. Reynolds is monitoring levels of MRSA bacteria in the home by identifying its survival on soft surfaces, including carpets and towels. Her message today is extremely timely, as from a scientist's point of view, we can continue to develop and improve methods to identify biological hazards, but that information is only impactful if the public actively participates in reducing their exposure to these known and unknown pathogens. Let's have a warm, socially distanced Rotary welcome for Dr. Kelly Reynolds.
Hello, I'm Kelly Reynolds, professor at the University of Arizona in the Community, Environment, and Policy Department. And I'm here today to talk a little bit about the COVID-19 disease and the COVID virus, and to tell you a little bit more about how, as businesses start to reopen, how you can really stay safe, not just at work, but also at home. So we've all heard the basic strategies of infection prevention, hand hygiene, surface disinfection, quarantining or self-isolating, social distancing, and even wearing face masks. But I think some of the direction that's out there, we're not sure how to really apply it. For example, what should be the frequency of hand washing? Where is it most appropriate to wear a mask? And do I have to wear a mask all the time? And as we go back to work, I think these are some of the really primary questions that people are asking. How do I know I'm using the right products for disinfection? When do I need to disinfect? And so that's some of what we're going to be talking about in the slideshow today. So let's talk a little bit about virus characteristics. A virus in a typical sneeze, will travel a 3 to 6 foot trajectory. Most of the aerosols in a sneeze, the large droplet aerosols, which you're hearing the most about in terms of spreading the COVID virus, is that it can spread for 3 to 6 feet and maybe even further. So you're hearing things about, is 6 feet enough? Is 12 feet better? And the answer is really 6 feet is enough for the large droplets that settle very quickly. But there are some small droplet aerosols that can spread even further. And some people are estimating even up to 20 feet or more. A sneeze can travel at 100 to 200 miles per hour. So when somebody sneezes in your vicinity, it would be very difficult to get out of their way. And so that's why we're really promoting wearing masks. And it's really that the mask will protect the person who is sneezing. It will protect you from coming into contact with their large droplet aerosols. It's not 100% effective, but it will provide some barrier for transmission of the disease. Now, once the aerosols release into the air, we know that they settle on surfaces within about 10 minutes or less, and that's where you may have a longer period of time of potential exposure, because on surfaces the virus can survive for hours to days, and we've seen some evidence that it can even survive up to 9 days, even 17 days, and some data that has been published out there. But the reality is we're still learning a lot about this virus, and that may be the extreme survival time. But depending on how the virus is suspended on surfaces, whether it's in mucus or saliva or feces. We know it can be shed in feces. We're not sure if it's viable in feces or can be spread to other people that way, but it's very hardy if it's in fecal particles, and it can survive for days on surfaces at that point. So like I say, we're still learning a lot about this virus, and I think at this point, the idea is to really put the most protective precautions in place that you possibly can to reduce your risk of infection and exposure. Now, the other thing that's really tricky about the coronavirus is that up to 25% of people who are infected, we believe, are asymptomatic. So you can have the virus, it can be growing in your body, you can be spreading it through your breath or aerosols from coughing and sneezing. However, you don't even know you're sick. And so that's another reason why the directive has been for everyone to wear face masks in case you are part of that asymptomatic population. I think that's going to be very, very important as we start to go back to work and we're in contact with more people. It's going to be more difficult to maintain the social distancing. So we look at our next best defense is blocking those aerosols by wearing masks and really focusing on surface disinfection and hand hygiene. Up to 44%, we believe, of the spread of the coronavirus at this time is due to the pre-symptomatic phase. So before you even know you're sick, the virus is multiplying in your body. This is not the same as the asymptomatic phase because eventually these people run into being symptomatic. And we know that people are most contagious when they have their peak symptoms, more coughing, more sneezing. We know they're more contagious. But many people can spread the disease before they know they're sick or even through the course of illness when they're ill and don't know it. So I really want to talk about my specialty of research, which is fomite contamination. And fomites are simply surfaces. So every pen, every sunglass, tabletop, these are all fomites. They're inanimate objects, and we know they play a significant role in germ transmission overall. How big of a role they play with the coronavirus is still being researched and investigated, but overall it's a good idea to maintain a hygienic environment because as this slide shows, if you're a person who's ill, and let's say you go to work sick, you sneeze, and we talked about how the aerosols can spread, the aerosols settle on fomite surfaces, survive for long periods of time, but it's when you come into contact with your hands with those fomites, and then you can transmit the virus to your body through your eyes, nose, and mouth. The coronavirus is most likely spread through the nasal passage with that cycle of transmission, and so we really want to be conscious about how often we touch our face and really try to minimize the number of face touches. We've done a lot of research at the University of Arizona looking at how often people touch their face, and I've been doing a lot of observing people wearing face masks. I can tell you that if you're wearing a face mask, you tend to touch your face a lot more than you normally would. It's just something we're not used to wearing, and it's a difference that we think we always need to really adjust. So it's really important to think about how fomites can transmit illnesses. Another study we conducted at the University of Arizona was we actually planted a virus. This was a real virus. It just didn't infect people. It infects bacteria. So this virus we planted in a healthcare environment. This is a diagram of a long-term care facility. And we mimicked if one of the surfaces, actually two surfaces in this facility, became contaminated by a sick patient, how would that virus spread throughout the facility, throughout the workday? We were actually surprised that it was pretty easy to find the virus after only 4 hours of seeding the site with the virus. We saw it spread through the entire facility. So in the diagram, everywhere you see a blue dot is where we placed our tracer, and everywhere you see a red dot is where by lunchtime, after 4 hours of seeding the environment, we saw the tracer spread throughout the entire facility and even in separate wings of the healthcare facility. So overall, 64% of the surfaces we tested post-inoculation were positive. So it's really important to understand how our hands play a role in germ transmission. Not just coronavirus, but influenza virus, other common cold viruses, other enteric viruses like norovirus, rotavirus that cause diarrhea. This is a primary route of transmission that we want to try and stop. So hand washing and surface disinfection can break this cycle of transmission. Another study we did at the University of Arizona was to mimic somebody going to work sick. And this is really important to see what happens if you go to work sick, which is really not advised because you can really potentially contaminate so many other people in the office. So in this study, we call it the Office Wellness Study. It was conducted at the Mellon Enid Zuckerman College of Public Health. But we see that what we did was seated one person's hands as the sick person going to work. And when that person went to work, we told them, go about your normal work day, wash your hands when you normally would, and we're just going to see if the virus spreads throughout the environment. What we found again by lunchtime is that over 50% of the surfaces in the office building that we tested were contaminated with the virus tracer off of one person's hands. over 50% of that person's work colleagues, when we tested their hands at lunchtime, were contaminated with the seed virus. So we didn't expect the results to be this dramatic. And the reality is that even if one person comes to work sick, they can spread viral contamination to half the surfaces in half of their coworkers' hands in just a few hours. We also in this study implemented an intervention, and this was a very simple intervention. We provided hand sanitizer, we provided disinfecting wipes and tissues to everyone in the office, and it was an office building of about 80 people. 40 people said, no thanks, I don't really need the products, I don't want to use the products. 40 people said, we'll take the products. So the other interesting thing about this study is only about half the population agreed to be compliant with using hand sanitizers and disinfecting surfaces around their workspace. So even with a fairly low compliance rate, we see that in the intervention phase of this study, the same seated person going back to work, doing what they normally do. And we did this multiple times, but we found that by lunchtime, only 10% of the coworkers tested positive and only 9% of the surfaces. So that was over an 80% reduction of contamination levels in the workplace. Now we calculated what an 80% reduction of exposure would mean for people coming into contact with a virus in the workplace, and we found that that resulted in about an 80% reduction of respiratory and enteric infection risk for the workplace. So really important as you're going back to work and at home as well, that you're maintaining good hand hygiene, frequent hand hygiene, and you're also making sure to disinfect surfaces. And if you have to sneeze or cough, do it in a tissue, throw the tissue away so you're not contaminating other surfaces with your sneeze or cough. We know it has a very positive effect on reducing risk of illness. So non-occupational hazards. A lot of people ask me, okay, I'm going to work, and work is work. I have no choice to be there. But when I'm home, how do I make sure I don't bring things from work back home? I want to make sure I'm not exposing my family to things I might pick up in the external home environment. And we did the same kind of tracer study in a home environment, and the results are really interesting. We studied both homes where people had an active influenza infection, a real influenza infection, and then we also did a similar tracer study where we mimicked if one person came home with a virus on their hands, how would it spread throughout the household? And what we learned is that germs spread really fast at home. So 100% of the family members' hands tested positive for our tracer virus and for the influenza virus, and about 98% of the high-touch surfaces. And you can see on this slide a list of some of the surfaces we sampled, just the kitchen table, countertops, bathroom counters, light switches, remotes, bedroom door handles. Maybe these are things you don't think about disinfecting in your home, but these are high-touch surfaces that we know play a key role in the transmission of germs through fomites. The other interesting thing about this that we learned is just watching people's behaviors at home. You feel more comfortable at home. You don't think about your home as being a site of germ transmission. But in fact, it's that act of letting your guard down that's probably creating behaviors that spread pathogens even more efficiently. So think about what you can do at home. I hear a lot of people are having designated decon people at home or turning their mud rooms into decon rooms, decontamination rooms. And this is a good idea. If you're coming back, especially at the time when we're in a pandemic, if you're coming back from work, it's a good idea to have an area where you change your clothes, certainly change your shoes. There's been a number of studies showing, even before the coronavirus outbreak, but even during the coronavirus outbreak, that shoes can be contaminated from healthcare workers, the most recent study, and brought home. So we want to make sure that we're changing shoes. Might be a good idea to have a designated pair of shoes in the home, and maybe it's something that can be easily disinfected. A simple disinfecting wipe down of your shoes can really reduce the germ count. We've seen these interventions be very, very effective. So with the field data that I was talking about, our tracer studies, how do we link this data to real health outcomes? And in research, we do this using a process called quantitative microbial risk assessment, or QMRA. And it's really a mathematical modeling approach. We can predict with some very efficient very essential probability that if you get exposed to a germ, what's your likelihood of becoming sick? And so there's a lot of research on this, and this is how we calculate if you have germs in the environment at a certain level, what's the probability you'll be exposed, and then if you're exposed, what's the probability of getting sick? And there's a number of different studies that we've done here at the University of Arizona. These are all published data reports in peer-reviewed journals. And you can kind of scroll through very similar studies with tracers that we've done in offices, in urgent care environments, in hotels. This was interesting. In a hotel, some of you are going to be traveling as you get back to work. But we planted our seed tracer in one hotel room, so pretending one person in that room was sick, and then sampled different rooms as the cleaning staff moved from one room to another. And when we sampled those rooms in succession, we found that the virus spread from that first room to 3 to 5 rooms after that. And we found it in a conference room where there was a conference going on at the same time. So our tracer was being spread throughout the hotel facility. But when we implement these interventions that I've been talking about, simple interventions, hand hygiene, surface disinfection, and now we're really promoting social distancing and mask wearing or other barriers, we find that they're very effective. And you can see on the right side with the red bold the probability reduction that we have in disease from these simple interventions. So up to 99% reduction in the home if you're using proper disinfecting products. Another study, I really want to present to you some of the evidence we have, because I think many people are not hopeful that there's a way to stay healthy when we go back to work, that it's inevitable that we're going to see disease spikes. And while that may be true on some level, we have a lot of control of preventing disease transmission in our own environments. You have a lot of control in your home environments and in your workplace environments. And even if not everybody is practicing these interventions perfectly, we know that it can still have a big impact at a population level. So this was a study we did with Tucson Fire Department. They actually called us around 2006 and said they were having an outbreak of MRSA infections. MRSA is a bacterial infection, it's a staph infection, and this is a methicillin-resistant staph. So that means it's an antibacterial-resistant strain of bacteria and very difficult to treat. So at the time we were called in to do an evaluation of their work site, they had 19 cases of MRSA that were actively going on. 4 of those cases were very serious. They resulted in a hospitalization, or 4 hospitalizations. And then we also had source tracking information that one infection in one of the firefighters was transmitted to their 6-month-old daughter at home. And these were very serious infections. When we sampled their work site, we found that about 7% of the surfaces tested positive for MRSA. Where we found the most positive sites were soft surfaces. So these are things like upholstered chairs and couches. These are very difficult to disinfect. I think most of us know this. So wherever possible in your workplace, if you can swap out upholstered furniture for something that you can disinfect with disinfecting wipes, like a pleather-like material or a vinyl pad on a chair, those are much easier to disinfect, and we really recommend that as an alternative. As you're buying new furniture, think about that as a germ prevention strategy. So we came in and did our site assessment. We evaluated, they needed to get rid of soft surfaces, which they did. We implemented some simple protocols for infection control, hand sanitizing at specific places. And one thing I really want to stress to you is that it's important for you to do your own site-specific assessment. What are the hot spots in your work environment or your home environment? What are the high-touch surfaces? What are the targets for infection control? And I think most of us have a good sense for this. What are the things that get the dirtiest in your home or at your workplace? And that's what you need to target for cleaning and disinfecting. So when we did this with Tucson Fire, we found that their station services were the most contaminated. The ambulances and the medic trucks, where they serve patients, were very, very clean. But it was their station environment, so their home-like environment, where they let their guard down and they weren't as diligent about what to clean. And when we implemented our infection control strategy there, we saw 0 MRSA cases for the next 3 years. And we found just a random positive of the bacteria over time on their surfaces. And we tested a lot of surfaces. So from this information, we developed an infection control training and an infection control checklist. I'll show you what that looks like in a moment. And you can access that by the link that I have here, a YouTube link. It's a 10-minute micro training, a rapid training video that has some really good hints for how to stay healthy at work, especially if you work in the healthcare environment. So what we've learned from interventions, these simple interventions I've been talking about, is that they work. So high-touch surfaces is something you really want to target. Soft surfaces, try to eliminate. Even low-touch surfaces, though, can play a role. So have some kind of routine where you target surfaces that maybe aren't high-touch, but they can still be part of the cycle of transmission. Maybe it's just not what you have to target on a daily basis. So think about what your workplace looks like, what your workflow looks like, what are the surfaces people come into contact with, and implement your own site-specific assessment and disinfection protocol. I should mention at the bottom of the slide there is a link to the EPA. They call it the List N. These are a list of disinfectants that have been registered that are effective against coronavirus and other microbial pathogens. So that's a good list to just kind of look up and make sure that whatever product you're using is on this list and we know that it actually kills the virus. There's a lot of different products out there, and not all of them are effective against coronavirus. So the other thing you can do is turn the product over, look at the back label, and there's a teeny tiny registration number from the EPA if it's a registered disinfectant. And so if you see that registration number, you can be assured that it's been tested for the claims that it's making on the label and that it's effective. The other thing I want to warn people about are the cleaning tools that you're using. Sponges and mops, these are things we found in our hotel study, were very effective spreaders of germs. So make sure that you're cleaning your cleaning tools, like your sponges and mops, in a disinfecting wash as well, drying them out completely between uses so that you're not spreading more germs, because they can absolutely collect more pathogens on those surfaces. So the CDC has a policy for really what's required to reopen and relax our social isolation policies. And this is just some of the information that the CDC has posted. If a city is seeing a downward trajectory in cases for 14 days, if they have a robust testing program, then there's more confidence that they can reopen and reopen safely. This was data on the right side. You see a map of the United States and different cities where we're seeing very high cases, the total number of cases and deaths as of May 28th of this year. And it's still very concerning. We're still seeing a lot of spread of the virus. So all the more reason as we go back to work and we're transferring between work and home that we're making sure to be very cautious with some of the tips and protocols that I'm telling you about today. So this is what I like to call the hierarchy of controls, and other people refer to it as the pyramid of prevention. And so this upside-down pyramid is meant to really categorize some of the controls you have at your disposal to reduce the cycle of germ transmission. Physical distancing has been the most effective intervention, and so that's why we've been really promoting it. 6 feet or more is the directive. But you also have engineering controls at your disposal. So things like increasing the ventilation in your workspaces or in your home, increasing your intake volume of air and recirculating air at a higher rate will help to keep more clean air in your workspace, in your home space, and flush out any air that may be contaminated by somebody who's spreading the virus. Other things that you can do that we consider engineering controls. Engineering controls, in a sense, are passive controls. These are things that your workers don't have to do anything. They just exist in the workplace, and these things are happening automatically to reduce their exposure. So again, ventilation and installing barriers. I think many of us have seen plexiglass barriers being installed at gas stations or any frontline workers. This could be very effective for, again, reducing aerosol transmission from people coming to your work site. The other thing I want to highlight are administrative controls. You have a lot of options for how do you manage administratively your workflow, the schedules of your employees. Maybe you can stagger that. Maybe you can have some people working from home. You could administratively put in policies for how often you're going to disinfect the environment and who's going to be designated to do that. How will the products be provided? Will you have a sanitizing station? These are all decisions you can make well in advance and put policies in place administratively and train your employees on what they can do to stay healthier and contribute. I think many employees want to be a part of that site-specific planning. I think many of them will have good feedback and information to share on what they think will work and what they're willing to be compliant with. So really engage your employees in that conversation. Now, at the bottom of this pyramid is PPE, that's personal protective equipment. These can be very effective products. These are things like your face masks. These are things like making sure that people personally submit to testing or temperature checks. These are things that we can do to really protect that person at the frontline level. We say this is the least effective intervention because many people just are not compliant. I think we've all seen people touching their face masks, which is not advised, but it's hard to not adjust them. They fall down, you need to pull them up. But at that point, you maybe have contaminated your hands by whatever was collected on the mask. So that's why we say PPE isn't our best line of defense. Let's try and put in as many passive barriers as we possibly can from engineering controls, but it's certainly part of our pyramid of prevention. Another thing to think about are the 3 T's. This is testing, tracing, and treating. We know that infection screening is going to be very important as we start to become in closer contact with other people. Regular temperature scans is something you should really implement in the workplace or advocate for your workplace to implement. Daily health checks, just even a simple questionnaire, having people really stop and take note. Am I feeling well today? Am I not feeling well today? And just drawing attention to, if you're not feeling well today, we support you staying home. So having those policies in place where you're a workplace that supports people staying home will protect your entire workforce, and it's worth your while to do that. Diagnostic and serology testing, we're hearing a lot about that. This can be very effective for knowing if you have asymptomatic infections, people carrying the virus, but they're not perfect. They're not 100% effective. You can have false positives, you can have false negatives. So we need to really understand what they're telling us and understand what they can't tell us. But it's another line of defense you may have for trying to protect the workplace and having a surveillance in place to make sure people who are sick are not coming to work. Contact tracing. I'm going to show you a slide in a few minutes about one of the local apps we have in Arizona, but there's a lot of apps out there right now that can actually collect health information from you anonymously and then identify if there's increased cases in your local area. So that might be very important for really helping your health department track, are we seeing a spike in cases? Is there a zip code in particular where we're seeing a really big spike in cases, and maybe there's a certain facility there that we need to see if an intervention needs to be put into place. So I recommend that you sign up for one of these apps. Hopefully your entire workplace will sign up for the same app because it's run by a zip code, and so you can identify if you're seeing an outbreak in your area, and you maybe can step up some of these infection control protocols that we're talking about. Treating is maybe a little bit far off. We're doing a lot of research on it. But we may be 18 months out before there's an effective vaccine that is widely available to our population. So we're not so much relying on treatments yet, but hopeful that they're coming down the pike. But because we don't have very effective treatments right now or vaccines, again, that's why it's so important to reduce your exposure in the first place, since we can't treat you post-exposure very effectively. So thinking about some of the things we've talked about today, doing your own hazard assessment in your workplace, encouraging the use of PPE and training people on how to use it effectively, and really identifying environmental hygiene interventions and behavioral awareness. The other thing I just want to touch on briefly, we haven't heard too much about it. It is on the CDC website. I've done a lot of research on this myself. We've developed a training at the University of Arizona on this, but it's Legionella infections. So with many buildings having been shut down, if there wasn't somebody in your building routinely running the water faucets, then you could have water that is stagnant in your premise plumbing when you come back to the building. And we know that stagnant water in pipes grows Legionella. And Legionella is a very serious respiratory infection, highly fatal infection. We want to make sure that we're not creating new exposures to a different type of pathogen because we've shut down our buildings. So make sure that when you come back to work, somebody is designated to flush all of the pipes if that hasn't been done routinely while your building was shut down. Other things, I just want to talk about the importance of community resilience and really coming together as a team and making sure to have that culture in your workplace. The University of Arizona has done a lot of work on how can we really support the community. So this is one example. One laboratory at the university made face masks, and I know a lot of people in our community have been sewing like crazy to make face masks and donate face masks. So it's been really nice to see the community come together around those interventions. And I really like this face mask, or really a face shield, because you can see the person's face and expression, and it will still block the aerosols. A lot of people say, well, won't they move around the shield? Yes, but remember, we're trying to block those really large aerosols, which we know are the most effective at transmitting the disease. This is a link or a promo really for the app that I was talking about. This is the AZ COVID Text or ACT app. You can log on Google and just type this in and it'll pop right up. It's at the University of Arizona website. And all you have to do is text this phone number below. Just text JOIN. And if you're in Arizona, this is Arizona specific, but if you're in Arizona, you'll put in your zip code and this app will prompt you once in a while, I think it's about weekly, to say, how are you feeling this week? Is anybody in your family sick? Are you sick? And then it will just gather some information. It's completely anonymous, but it's tracking by zip code. So if we see something going on in a zip code, then the health department can be notified and respond to that. So this will really help with contact tracing if we can get a large population signing up for this app. The other thing to really think about is signage. Signage really works. It's just you have to change it out periodically because people get so compliant, so they just don't notice the signs after a while. So we want to make sure that you change the signs out, but we have these signs available at the University of Arizona website with the College of Public Health. So if you would like to use some of our signs, you can download them and use them. We have them in Spanish and also English, but this one's specific to hand washing. And I think before COVID-19, most people thought, I know how to wash my hands. But now we're much more aware that, are you doing it for 20 seconds? Are you really washing the tops of your hands and the palms and between your fingers and your wrists and your fingernails? So it takes 20 seconds to do it properly. And if you really time yourself, you'll realize it feels like a long time. But that's really important for making sure you have enough efficacy for hand washing. The University of Arizona has also come up with, I think, these really great thematic signage. So if you have an opportunity in your workplace to make a sign that's very specific to the kind of work you do, I think people enjoy seeing those. And so this is our college mascots, Wilbur and Wilma, wearing masks, and just more information about reminders of social distancing, even as we go back to school and work. This was a project we did for the Food Bank of Southern Arizona, and this is an example of a site-specific guideline. So we helped the food bank, really prompted them to observe what was going on in their workplace, where they needed to have close contact with their clients and other coworkers, and what are some things they can identify that are hotspots for germ transmission. And we created this checklist. Yours might be more simple, maybe it's just a single page, but provide this to employees. Let them know these things are important to us, and prompt them to check off, have you done this today in your workspace? And that will be very important, I think, in really tracking and creating a culture that this is important, that these interventions are valued. The other thing to think about, this was a study we did on wheelchairs. We called it Spores on Wheels because the wheelchairs in hospital environments aren't necessarily disinfected between patient use. And so we were finding that there was a high level of contamination that was wheeled all throughout the healthcare facility. And so I'm showing you this slide not because maybe all of you are in the healthcare environment, but just to think about equipment in your environments that maybe are likely to be contaminated but rarely disinfected. Are you thinking about some of these cross-contamination potential equipment that could spread illness? And so it's just something to think about. What's specific to your work environment? Where do you find reliable information? I am a big proponent of the CDC right now because I think they've really stepped up and provided very current information. They're constantly updating their websites. I think it's a great site to go to get the most current information. And so they have lots of directives on how to clean the workplace. What if we find out somebody came to work and was sick? What do we do to disinfect our workplace? They have detailed information and very concise couple of pages worth of information on what you can do, really practical advice. So I'll direct you there for the most up-to-date information beyond this presentation. And the other thing that I think is a really good resource site is the World Health Organization's Mythbusters. We're hearing a lot of rumors out there about, does this kill coronavirus? Does this cure coronavirus? And the reality is that there are a lot of myths. And so the WHO has this really nice Mythbusters website. You can download the posters and post them in your facility and just really try to squash some of the rumors that are out there. Eating spicy food does not kill the virus, and drinking alcohol, does not kill the virus. So there's a number of things that people, maybe wish would work but don't. And so we need to make sure we have the proper facts and make sure that these rumors aren't circulating throughout our workspace. We can help spread proper information. So with that, that's the end of my talk, and I'm just putting some contact information on this last slide. Please feel free to email me or visit my website, which is the Environment Exposure Science and Risk Assessment Center, or ESRAC.arizona.edu. For more information, we're constantly updating our outreach materials as well, and I'd be happy to take any questions any of you have. Just please reach out to me. Thank you.